Ladies and gentlemen, good day. Welcome back to the series of lectures on coronary heart disease, understanding risk factors, and how we can actually strategize to mitigate and prevent them. We will be looking at the risk assessment. How do we know which ones at higher risk, which ones at lower risk, but still be able to plan for both, on how we prevent or mitigate the coronary heart disease, complications and related issues. Then we'll look at which ones are the modifiable, non-modifiable factors, to categorize these so that we know which ones can we mitigate and which ones can we modify. Is there anything we can do about anything? Is there anything that we can't do? And then we'll look at the various interventions that we can do for coronary heart disease patients. So in the introduction, we are looking at understanding coronary heart disease should only begin by recognizing the factors and how this is very, very important in early assessment and creates the foundation on how we will look for information by questioning our clients to be able to counsel them and provide mechanisms to help them. Significance of questions and answers in terms of devising or collecting information on how we can intervene is that patients should be engaged. You know, in our settings in community pharmacy, we have been trying to develop skills on engaging patients and clients so that when we have the information, we can educate them and provide the necessary awareness and also use that information to make plans on how we help them. Modifiable versus non-modifiable factors. So the factors that contribute to the risk of coronary heart disease are categorized into modifiable and non-modifiable factors. The modifiable factors, the non-modifiable factors are those like age, gender, genetics. We can't control these ones, but we can actually recognize these if they contribute to the risk and encourage the patients using the information about this on how they can modify various risks to ensure that if they are predisposed based on their age, gender, and genetics, then they should do something about it in terms of managing their lifestyle and other risks. Then for the modifiable factors, we are talking about those factors that we can actually modify or alter so that the patient risks are reduced in terms of coronary heart disease. Early risk assessment is an issue of timely intervention. Early risk assessment can lead to timely intervention that will significantly reduce the prevalence of this condition. And how can this be done is that every time the patient is in contact with the healthcare provider, they should be assessed in terms of having checkups in relation to all the various risks that can lead to their predisposition to coronary heart disease. And so that then preventive measures can be seriously done to identify the risk factors early and prevent them so that they don't develop into serious health issues that can contribute overly to development of coronary heart disease. For modifiable factors, non-modifiable factors, as I mentioned, we are talking about age, gender, genetics, and again, this we are saying old age, for example, predisposes to coronary heart disease. Males are more predisposed to this disease than females. For ethnic and origin for the patients, the African black population are more at risk to coronary heart disease, but this has also been seen in the Asian population, where there is increased rate of coronary heart disease, which can be attributed to their genetic predisposition and lifestyle choices. Family history, it has been noticed that if coronary heart disease prevails in the family, and also there's been someone who has been affected or has died of conditions related to this, it is important for patients to know so that they also begin to have preventive measures. Otherwise, their risk is also higher if the family trend exists in coronary heart disease. Concerning age and gender, the impact is that as age increases, the risk for coronary heart disease increases as well. Additionally, the differences in risk levels between men and women highlights the importance of gender-specific approaches in prevention, that males at a certain age throughout, I think, their adulthood into old age, they are more predisposed to coronary heart disease. But females are protected by the levels of estrogen, and their coronary heart disease risk increases as they move into menopause. Um, we've talked about menopause and how the levels of estrogen affects that. We've talked about ethnic predisposition. We've talked about how genetic issues in the Asian population predisposes them to coronary heart disease. Family history is also crucial. Um, the modifiable factors, these will be factors that play a crucial role in prevention of coronary heart disease. Addressing these ones can lead to significant improvements in heart health. So we are talking about smoking. Obviously, someone has to stop smoking, and there are measures in the pharmaceutical settings. Community pharmacy, we can provide replacements for nicotine in different formulations, gums, sprays, and all these things that can help speed up the process of cessation of smoking. The benefits of smoking are such that someone's risk of coronary heart disease reduces significantly upon cessation of smoking. Maintenance of body mass index and waist circumference. It's been noticed that if the body mass index is less than 25, then there is higher chances of reduced risk. But above 25, going into overweight and eventually into obesity, the chances of coronary heart disease increases for every increase in the body mass index. But also the waist circumference. It has been noticed that less than 94 centimeters and less than 80 centimeters for males and females respectively reduces the body mass. It reduces the risk of coronary heart disease comparable to body mass index of less than 25 kgs per square meter. So in other words, we are saying if we can reduce this, we also reduce BMI, will significantly contribute to the reduction in prevalence of coronary heart disease. And so it is crucial that we go into that. We will continue in the next lecture looking at these modifiable factors.